What if I told you that a hidden danger could be lurking in your daily routine, one that doctors can spot within minutes, but you may have been ignoring for years? For many older adults, these aren't just small hygiene slip-ups. They're red flags, early warning signs of serious conditions that could quietly steal away health, independence, and even life itself. Shocking as it sounds, thousands of elderly individuals unknowingly sabotage their well-being through routine habits they believe are harmless. And worse, no one tells them. Not the magazines, not their caregivers. Sometimes not even their doctors until it's too late. But today, that changes. You're about to uncover 6 hygiene mistakes most seniors don't even realize they're making, yet doctors can spot them instantly. Fixing just one of these could mean the difference between early detection and a health emergency. These insights aren't just life-improving, they could be life-saving. Let me share the story of Harold, a 75-year-old grandfather who lived an active, joyful life. He thought he was doing everything right, shaving daily, brushing his teeth, staying social. But a routine checkup changed everything. Within minutes, his doctor noticed subtle signs that Harold's body was in distress. He was developing a dangerous condition that had gone completely unnoticed. "I felt fine," Harold later said. "I didn't think twice about it, but now I realize how close I came to something irreversible." So, let's start with 2 of the most common hygiene habits that may be putting you, or someone you love, at risk. 1. Infrequent bathing. It might feel harmless to skip a few showers, especially when mobility becomes harder or winter air dries out your skin. But did you know your skin can act like a mirror for your internal health? And what it reflects can be downright alarming. Doctors at the Mayo Clinic reveal that dry patches, discoloration, or changes in skin texture can be early indicators of serious illnesses, ranging from liver disease to diabetes to kidney dysfunction. The problem? These changes are easy to miss if you're not bathing regularly. Let me tell you about Clarence, a retired postal worker who bathed once a week. "I just didn't want to dry my skin out," he said. But his physician noticed something odd, a change in the color of the skin near his lower back. That small observation led to testing, which revealed early-stage kidney disease. The signs had been there, but hidden under layers of dry skin and time. What should you do? Aim to bathe at least 3 times per week, even if you're mostly indoors. Use a gentle, fragrance-free cleanser that won't strip natural oils. After bathing, moisturize while your skin is still damp to lock in hydration. And most importantly, inspect your skin. Do you notice any patches that don't feel right? Persistent itchiness? Areas of unexplained dryness? These aren't just cosmetic quirks. They're your body's way of begging for attention. 2. Neglecting oral care. When you think of brushing your teeth, what comes to mind? Fresh breath, preventing cavities. While those are important, the real danger of poor oral hygiene lies far deeper, potentially reaching your heart. Medical research from Harvard has shown a chilling link between gum disease and heart complications. Bacteria from inflamed or bleeding gums can slip into your bloodstream and cause inflammation in your arteries and heart valves. In fact, seniors with poor dental habits are 3 times more likely to suffer from cardiovascular issues. Take Sylvia, for example, a 68-year-old retired teacher. She brushed occasionally and thought bleeding gums were just part of aging. But her cardiologist thought otherwise. A checkup revealed heart valve inflammation directly linked to bacteria traveling from her mouth. She was stunned. "I didn't know the danger was coming from my gums," she admitted. So what's the fix? Start by checking your toothbrush. If it's older than 3 months or has frayed bristles, toss it. Switch to an electric toothbrush if you can. It removes significantly more plaque. Brush twice daily for a full 2 minutes. Floss every night, no exceptions. And even if you wear dentures, get regular dental checkups. Your mouth is more than just a smile. It's a critical indicator of your body's overall health. 3. Improper incontinence management. This is one topic most people shy away from. Even doctors sometimes hesitate to bring it up unless you do. But let's be clear, incontinence is not just an embarrassing nuisance. It's a serious red flag that something inside your body may be going wrong. Over 50% of older adults quietly deal with some form of urinary leakage. Most try to hide it, by using makeshift absorbents like paper towels or changing clothes often. But that silence can come at a steep price. Take Douglas, a 73-year-old former accountant. Too embarrassed to speak up, he masked his symptoms for months. "I thought I was managing it," he confessed. But when painful sores developed, his doctor found something much more serious: an advanced prostate condition that had gone undiagnosed for too long. The damage could have been minimized if he'd spoken up sooner. Doctors from Johns Hopkins warn that untreated incontinence often leads to skin infections, falls, and even social isolation. In some cases, it masks conditions like bladder cancer or serious urinary tract infections that need immediate attention. What should you do? First, release the shame. This is more common than you think, and your doctor won't be surprised or judgmental. Use proper incontinence products designed to keep skin dry and clean. Change them promptly and cleanse the area gently but thoroughly. And most importantly, talk to your doctor at the very first sign of leakage. Don't gamble with your health over pride. Are you planning your outings around bathroom availability, avoiding social events? That's not just inconvenient, it's a signal. Listen to it. 4. Nail neglect. When was the last time you inspected your nails? Not for polish or grooming, but for signs of what's going on inside your body. Because believe it or not, your nails are among the first places doctors look when assessing your internal health. A change in color, a ridge that wasn't there before, thickening or brittleness. These aren't just cosmetic quirks, they're flashing warning lights. Doctors from the American Academy of Dermatology report that nail abnormalities in older adults have helped diagnose everything from thyroid disease to anemia, even hidden heart conditions. In fact, nearly 1 in 3 seniors with serious internal issues had nail symptoms long before other signs appeared. Let me tell you about Beatrice, 82 years old and proud of her independence. Her toenails had yellowed and thickened over the years, but she dismissed it as part of aging. When she finally saw a podiatrist for foot pain, the diagnosis wasn't just a fungal infection. It was a suppressed immune system revealing a bigger underlying illness. Here's what to do right now. Trim your nails regularly, straight across with rounded edges. Keep them clean and dry. Check for discoloration, thickening, or brittleness. If your nails suddenly change appearance, don't ignore it. It might be the first whisper of something serious, before your body starts shouting. 5. Poor foot hygiene. Your feet might not be the first thing you think of when it comes to health, but for doctors, they're a goldmine of medical clues. In fact, your feet are often the first place signs of serious conditions like diabetes, neuropathy, or poor circulation show up. Think about it. They carry your entire weight. They're the furthest from your heart, and they're often the most neglected, especially in older adults who may struggle to bend or see clearly. Let me introduce you to Raymond, a 76-year-old retired factory worker. He had dry, cracked heels and small sores that just wouldn't heal. "I thought it was just part of aging," he shrugged. But his doctor knew better. A quick foot check led to a blood test, which revealed undiagnosed diabetes. Thanks to early intervention, Raymond was able to manage it with lifestyle changes before complications like amputation became a real threat. Shocking fact. Podiatrists estimate that up to 85% of diabetes-related amputations in seniors could be prevented with proper foot care. Here's what you should do. Wash and thoroughly dry your feet daily, especially between the toes. Inspect them closely for cuts, sores, discoloration, or temperature changes. Wear clean, breathable socks and avoid walking barefoot, even at home. If you notice numbness, tingling, or pain that won't go away, don't wait. See your doctor immediately. Your feet might be trying to tell you something before the rest of your body catches up. 6. Ear cleaning mistakes. Most of us have done it, used a cotton swab to clean inside our ears. But what feels like a simple hygiene habit can actually do far more harm than good, especially for seniors. In fact, inserting anything into the ear canal can cause punctures, infections, and even permanent hearing damage. Let's talk about Patricia, a 71-year-old retired librarian. She'd cleaned her ears the same way for decades, until one day she felt a sharp pain. That cotton swab had punctured her eardrum. Within days, an infection spread, threatening her hearing permanently. "No one ever told me it was dangerous," she said with disbelief. According to specialists, nearly 40% of ear injuries in people over 65 are caused by improper ear cleaning. And here's the kicker. Many older adults mistake signs of hearing loss or infection as just getting older, when in reality, they're injuries that could have been prevented entirely. So, what's the safe routine? Never put anything smaller than your elbow in your ear. Seriously. Use a warm, damp cloth to gently wipe the outer ear. If you suspect wax buildup, use ear drops designed to soften it. Or, better yet, consult a doctor. If you experience pain, a feeling of fullness, drainage, or sudden hearing loss, don't try to fix it yourself. That's a job for a professional. Let's be honest, personal hygiene isn't usually something we associate with life or death situations. But as you've just seen, these 6 habits can be silent messengers, revealing critical health issues long before symptoms fully develop. They're not about vanity, they're about survival. Whether it's a discolored nail, an itchy patch of skin, or a normal leak you're too embarrassed to mention, these are signals. Your body is speaking. The real question is, are you listening? So, what should you do right now? Reassess your routine. Have an open conversation with your doctor. Share this knowledge with someone you love. Because knowing these signs could literally save a life, maybe even your own. If this opened your eyes, don't keep it to yourself. Like this video. Share it with your family. Post it in your community group, and subscribe for more life-saving tips that every senior and every caregiver should know. You have the power to protect your health. It starts with awareness, it starts with action. It starts today.